Hi, this is Dr. Paul Goldberg at the Goldberg Clinic. I want to talk with you today about a topic that's very near and dear to me, and that is ulcerative colitis, Crohn's disease, collectively known as inflammatory bowel disease. These are conditions that afflict a wide number of people in our population and cause a great and immense amount of suffering. Medical doctors treat the symptoms of these problems, usually with drugs, corticosteroids, biological agents, and ultimately many of these patients end up having portions or their entire colons removed. I'm here to tell you there's a better way to go about this. At the Goldberg Clinic, based on my experience, my personal experience having had inflammatory bowel disease in my 20s, and also having worked with patients with these conditions for over 30 years, based on those experiences, I strongly believe that the way to approach these problems is not to treat the conditions themselves, but to identify the reasons why people are having these problems to begin with. And in every person, the causes of it are different from person to person. Unlike in medicine, the medical field, in gastroenterology, where virtually everybody gets the same type of medicine or drug for these problems, we feel and we work in our clinic to do a personal workup on each patient so we can find out what is causing the inflammation, what's causing the cramping, what's causing the bleeding, and what is causing the general decline in the person's health. It's been my experience that you can have 20 different people with inflammatory bowel disease. You're going to have 20 different reasons in each patient why they have those problems. They're all going to be different. So people need to be addressed as individuals, not as a collective. We don't have ulcerative colitis patients and Crohn's disease patients. We happen to have patients who have been diagnosed medically with those conditions. And we work to establish the right conditions so that they can be healthy again, not just to suppress their symptoms with steroids, with all their side effects of cataracts and diabetes and osteoporosis, not with drugs such as Remicade that ends up oftentimes being unsuccessful because of side effects such as cancer, lymphoma, and tuberculosis, but by identifying causes that can be addressed in a healthful way. Also not by addressing these problems by giving them alternative treatments like alternative doctors do of herbs and Bach flower remedies and waving crystals over people's heads, but by trying to identify causes, addressing those causes, and establishing the right conditions for good health for those patients. One of the things that always is important, I think, and very useful for people who have these problems is to see other patients who have had these problems at a clinic such as ours and see what has happened with them, what kind of results did they obtain. So we have on our website at www.goldbergclinic.com, as well as on YouTube, we've assembled some interviews with patients with inflammatory bowel disease who we have pretty much completed our care with and who have recovered their health. And we invite you to take a look at those so that you can see a little bit and hear a little bit about actual case studies from the patient themselves, what happened, what their experiences were with us, and how they recovered. Hi, this is Dr. Paul Goldberg at the Goldberg Clinic. I'm here today, a very happy occasion. I'm with Mr. Matthew Wolford, who is from Illinois, Lansing, Illinois. Used to be in Illinois myself, as I told you, Peoria. And Matt came to see us. It has been what, Matt? It's been, was it April?
Yeah.
April 2013 when we saw Matt. Matt was originally referred to us from Miss Jenny Patel of Listen to Your Gut, which is a very fine organization, and Jenny makes a number of products and written a number of great books for helping people, self-help books for people with various gastrointestinal problems. And Matt came to see us because, and I'm going to let Matt talk to us about this, because of what, Matt? What was going on with you at the time you came to see us?
I was having pretty severe gastrointestinal inflammation. I was diagnosed with Crohn's disease about 4 years ago.
Where were you diagnosed with Crohn's disease at?
It was primarily the...
I mean, was it a physician?
Oh, where?
Yeah, where?
It was in New York City with a gastroenterologist.
With a medical gastroenterologist?
I was having blood in the stool. He recommended that I have a colonoscopy.
Okay.
We had that done. He came back, said textbook case of Crohn's, and then we started, some treatments. Things didn't work.
What were the symptoms you were having at the time, Matt?
I was having I was having blood in the stool, which is the most worrying because I'd never experienced anything like that.
It's no fun to see blood
No.
coming out of your rectum, I'm sure.
No, and just all of a sudden everything became much looser. I had to go much more frequently. I had to go.
At the worst point, how often were you having to run to the bathroom?
At my worst, I remember particularly there was a day when I had to go 30, 40 times. And
30 or 40 times?
Was very close to having to go to the hospital.
Okay.
And I had to, that's when I had to start taking massive doses of prednisone, really strong.
So you were on steroids?
Steroid,
For how long were you on steroids, man?
Off and on for about 2.5 to 3 years.
3 years of steroids, and how did that work for you?
The steroids worked well up until the point. I combined those with some pretty strong biologic medicines.
Which ones were you on?
I was on, well, really, I was probably on Humira, and they had to, because Humira worked.
You were on Humira, which is considered a biological drug. It's a strong immunosuppressant.
Mm-hmm.
It's what we call a TNF-alpha blocker.
So
you were on steroids, and I'm sorry to interrupt, and you were on Humira also, and why not just stay on those?
Because they would only provide a short window of relief. And the next step I remember with the Humira was doubling the dose. So it was bi-monthly, and then I started having to take them every week, and did that for about a year.
So they were becoming less effective?
Less effective, to the point where they stopped working.
To the point where they stopped working?
Yes.
Okay. And while you were on them, did you really feel healthy and vibrant, or were just your symptoms kind of controlled?
My symptoms were controlled, and my weight continued to balloon from that point. I mean, when I was first diagnosed, I probably weighed about 240 pounds.
Yes.
And just a few years later, I had gotten to 315 pounds at my height.
And this is while you were on the drugs, you gained all this weight.
Yes.
Okay. And Matt, you're a well-educated young man. You in fact, you're a graduate of Juilliard in New York City, played the trombone, and Juilliard is no easy school to get into, I know. And were you also, did they make you aware, or did you become aware of the side effects, the potential side effects of taking steroids or taking Humira?
Yes, but it was always with the caveat, it's in very small cases and something along those lines, to the point where it wasn't directly addressed by the doctor as a big concern. And for my need for relief was when I was more than willing to just kind of
take the risk,
and or just plead ignorance, and just not worry about it.
Right, because the symptoms were so severe.
Right.
Running to the bathroom 30 times a day, cramping, bleeding.
I would have done anything.
It put a big damper on your life, didn't it?
It did. And what happened eventually is, as I was saying, I was doing more and more of these medicines, and it got to the point where I was confronted with a choice of adding a drug that had been known to cause increased lymphoma risk in young males in particular. That was option A, and option B was surgery.
And you were already taking a drug that increases lymphoma risk.
Yeah. Right. And option B was surgery to have parts of the colon removed. And I should backtrack for a second to say, when my doctor first said textbook case of Crohn's, 2 years later, I was getting my master's degree at Northwestern University in Chicago. My doctor there performed my second colonoscopy, and was told textbook case of ulcerative colitis.
So you've now been diagnosed with Crohn's disease and ulcerative colitis, which are mostly differentiated primarily just because of the location in the intestines, with Crohn's being more subject to being a determinal portion of the ileum, and ulcerative colitis being more subject to being in the colon itself. And what happened after you saw the second doctor then?
Well, after I saw the second doctor, that's when I was well, I should say that was the first time I started realizing maybe there's a better way to do this, because it was the first time I'd gotten the feeling that these guys didn't have it all figured out. I had just had the assumption that all doctors, with the degrees on the wall, just knew these things. And
what do you think now about that?
I think I know more about a lot of these issues than your run-of-the-mill gastroenterologist.
And for one reason that you know a lot about is because it's your body, you live there, and you experience that. And most people that are gastroenterologists or any type of physician really have not experienced the types of problems that they're treating people for.
Right.
So you're right, I think the patient often knows the problem much, much better.
Yeah, I remember bringing up concerns, and and just kind of being shot down because they just dealt in the language of what can I prescribe you, or what can we add to this. So there was never any consideration of anything else.
So it's pretty straightforward. They did a few procedures such as a colonoscopy,
Yep.
and then once they made the diagnosis, which was based on the symptoms and signs, then it was half a dozen different drugs to choose from for you to take.
Exactly, and
Is that
that's very accurate.
That's pretty accurate. Okay.
And I was specifically told diet has no impact on my disease, and I took that to heart and ate whatever I wanted, which helped with the weight gain.
And you found out about the Goldberg Clinic, about us, from Ms. Patel. You had read some of her books, which are very, I think, very well written. And you came down to see us in April. And let's jump to the point we're at now. You've been on a program that we individualized for you after doing some testing on you, some functional lab testing and a case history physical exam. And a few months down the road, this April, May, June, July, we're now in August, about 3-4 months down the road. What is your situation now? How much overall improvement have you had?
I had said 70% improvement.
Okay, so in about 3 months you've had a 70% improvement.
Yes, 3 months ago I was feeling better than my very worst, but I couldn't really leave the house. I was still having to go to the bathroom 6, 7, 8, 9, 10 times a day, very urgently. And the case for me now is...
Yeah, tell us, what are the improvements that you experience?
The improvements that I've experienced is just a much more predictable and regular trips to the bathroom for myself. First thing I do when I wake up in the morning, and then maybe 1 or 2 times later.
And this is at the worst. You were at 30 to sometimes 30 times a day. Your worst at the worst time.
Yeah.
And during this time, have you been taking any drugs?
No.
Okay, so you are now drug-free. You don't have to worry about lymphoma. You don't have to worry about tuberculosis and other immunosuppressant drugs. Don't have to worry about the effects of steroids, which include diabetes and dissolution of your bones and depression and irritability and, good Lord, I probably missed a few more. Adrenal atrophy and cataracts. The list just goes on and on. And in addition to not having to run to the bathroom so frequently, what other improvements in your health do you feel now?
I have way more energy.
Way more energy. That's a good thing.
I feel it's hard to quantify. I just feel good. I guess it's weird, but I feel like I can go out and do things now. I felt very sheltered, very insulated for a number of years, very limited in what I could do.
And now you're able to get out and resume your life.
Correct.
Okay. All right. Thanks so much, Matt. And I'm probably a little more passionate about this particular area, having had ulcerative colitis myself as a young man. I know the frustration that goes with that, despair that goes with that, and going and seeing medical doctors, gastroenterologists, and just having drugs thrown at yourself and being warned that you're probably having surgery facing down the road. And it really is a destroyer of lives. And every patient that has been diagnosed like this, in my opinion, is very much different from the next. But one thing that we have found at the Goldberg Clinic is once we take time to identify what the causes of the problem are in each case and address them thoroughly, not from pills and not from potions, but by getting down to the causes of those problems, the patient can work their way back, gradually back to better health. And oftentimes, just as in Matt's case, even after taking the drugs that he did, in 3 months he's already 70% better. He's able to resume his life. Talented young man with an excellent education and able to go back and do the things in life that he wants to do. And otherwise, these diseases just really ruin people's lives, and in my opinion, unnecessarily. It does require not only good doctors, but it also requires, and this is even more important, it requires patients who are willing to do the hard work that it takes and have the will to get well. And Matt did the hard work. He's continuing to do the hard work, and he's reaping the benefits. Thanks so much, Matt.
Thank you.